Navigating healthcare today is about so much more than just the medical care. 80% of what influences a person's health has nothing to do with clinical care, apparently. And joining us now to explain more is Joe Acapenti. He is the CEO for United Healthcare of the Mid-Atlantic region. Welcome.
Thanks, Elsa. Thanks for having me.
Of course, we're happy to have you here. We know that United Healthcare recently was awarded more than $11 million in empowering health grants across the entire country, including more than $500,000 to a number of organizations right here in Maryland. So tell us about these grants and how we will feel it here as a community.
Yeah, absolutely. We started in 2018 in United Healthcare launching what's called Empowering Health grant and program. What it does is it really focuses on expanding access to care and addressing the social determinants of health for people in uninserved communities, but also maybe uninsured. So to date, the Empowering Health program has donated more than $40 million, reaching more than 6 million people through partnerships and community-based organizations in over 29 states.
These are very big numbers that you're talking about. I think that people sometimes don't understand the impact of how much good a grant like that can do in these communities. Tell me about why these grants and partnerships are so important for United Healthcare in general.
Yeah, absolutely. Great question. As part of our Empowering Health commitment, we really continue to partner with local organizations first to kind of understand what's needed in the local community, but then address these number of issues that are brought to us. Through this year's grants, we identified kind of 4 key areas. One is food insecurities. Second is social isolation. Third is behavioral health issues. And then the fourth is how we best support local health education in the community. And with our grants that we've issued in the state of Maryland, we selected 4 organizations that we feel focus on those 4 key areas. The first is the Maryland Food Bank. Yeah. We've provided over $250,000 to help increase education in getting food and wellness information and nutritional information out to the food pantries. That's focused statewide. The second is CASA. And we've provided about $150,000 to support COVID-19 vaccinations and also health education to the immigrant and Latino communities. And that has quite a significant focus in Baltimore and Prince George's County. The third is Springboard Community Services. So we provided just under $100,000 to support public campaigns that support mental health services. We know today in the pandemic, depression and anxiety remains at an all-time high. And then the last was community crisis services. Just over $50,000 was provided for mental health and first aid training to these first responders and community members who are out and active during this time.
Wow. I mean, really, you can tell a lot of thought went into who is getting these grants and that selection process. I can only imagine how tough that is because you've got how many people, applying and trying to get it.
Yeah, we had a lot of tremendous organizations in the state of Maryland. And, one of the things you mentioned in the beginning is that really 80% of what influences a person's health relates to non-medical issues. So things like food, housing, transportation, and really the financial means to make ends meet. So for many, this pandemic caused really an additional set of social and economic challenges that really continue to affect healthy behaviors and exacerbate these health disparities.
We hear a lot about that, about the health equity and, just why that is so important to make sure that we have. And I know that that is very important for United Healthcare.
It is, and health equity is all about helping people live the healthiest lives and making sure that they have the right access and optimal health. So often we see where we have inequalities or unfair differences in how people access and receive healthcare. And that's why United Healthcare, we remain passionate about making sure that we work with local organizations and continue to empower these health grants in local communities.
Well, I love that. For more information, of course, we can just go to uhc.com. Is that correct?
That is correct.
Okay. Joe Acapenti, thank you so much for being with us. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.